The single best exercise to lower your blood pressure. Have you ever felt like you've done everything right, from cutting back on salt, taking your medication regularly, to walking every day, and yet your blood pressure just won't go down? Many of my patients have been in that exact same situation. I remember one who told me, "Dr. Payne, I do yoga, I walk, I eat healthy, but every time I check my blood pressure, it still spikes like before." Have you ever wondered the same thing? We're all told that exercise is good for the heart, but very few people mention that not all workouts lower blood pressure. In fact, some can actually make your heart work harder, tighten your blood vessels, and increase the pressure inside your body. The truth is, the secret lies in the fact that we've been exercising the wrong way. Recently, a major study compared popular forms of exercise, from aerobic activities like walking and cycling to high-intensity interval training, or HIIT, strength training, and even combination routines. But only one group of exercises stood out as significantly more effective in lowering both systolic and diastolic blood pressure. That was isometric exercise, also known as static muscle contraction. I know, it sounds strange. How can you lower blood pressure by not moving, you might be thinking. Yet clinical data show that while aerobic exercises lower blood pressure by around 4 to 5 millimeters of mercury, isometric exercises can cut it by nearly twice that amount. And what's more, the effect lasts for weeks even after you stop training. Fascinating, isn't it? A type of exercise where your body hardly moves, yet your blood vessels become more flexible, your heart works easier, and your blood pressure drops naturally. So, what makes these still exercises so effective? When you contract your muscles and hold that position for several seconds or even minutes, the blood vessels inside the muscle constrict, and when you release, they expand more powerfully. Each repetition trains the vessel walls, helping them become more elastic and responsive to pressure changes. In other words, you're teaching your body to regulate its own blood pressure naturally. The more consistently you practice, the calmer your sympathetic nervous system becomes, and the less energy your heart has to expend. It's like performing maintenance on your body's entire pump and pipe system, keeping it smooth, durable, and free from leaks or blockages. Can you imagine that? Just 2 minutes of holding a position can help your blood vessels regain elasticity in a way no pill or walk can? The real question isn't, do you have the strength to exercise, but are you willing to spend 10 minutes a day to control your blood pressure for life? And if you're wondering, where do I start? How do I do it right? The next part is for you, because right now I'm going to show you the 3 simplest isometric exercises you can do right at home. The first one, and the one that delivers results fastest, requires only an item that every household already has. Can you guess what it is? Stay tuned, because in just a few seconds, you'll see how a simple hand towel can help you lower your blood pressure more effectively than any treadmill ever could. Are you ready? Because this is where we turn knowledge into action. And believe me, you won't need to go outside, buy expensive equipment, or run a single mile. All you need is a bit of patience, a small space, and your own 2 hands. Let's start with the first exercise. Hand grip, also known as the grip squeeze. This is the simplest one, yet it delivers surprisingly powerful results. All you need is a small object, like a rubber ball, a rolled-up towel, or even just your own fist. Hold it in your palm, squeeze it firmly, and hold that position. Yes, just hold it still, no movement required. But the question is, how hard should you squeeze? Most beginners tend to squeeze too tightly, which quickly tires out the muscles. In clinical studies, participants used only 30 to 50% of their maximum grip strength. What does that mean? It means you should squeeze with about half your full strength, like a firm handshake, strong enough to feel the pressure, but not so much that it causes discomfort. Hold that squeeze for 2 minutes, then rest for 2 minutes, and switch hands. Do a total of 4 rounds, 2 for the right hand and 2 for the left. It sounds simple, but you'll notice your body responding almost immediately. Your heart rate may rise slightly at first,
then gradually slow down and deepen. That sensation, that's your body adjusting its blood flow and vascular pressure. Fascinating, isn't it? A simple act like gripping your hand can help stabilize blood pressure. And the best part is, you can do this exercise anywhere, while watching TV, talking on the phone, or even waiting for the kettle to boil. So let me ask you, if just a few minutes a day could make that difference, would you give it a try? Now let's move on to the second exercise, leg extension, or static leg stretch. This one strengthens your quadriceps, the large muscles at the front of your thighs that play a key role in circulation to the lower body. Sit on a chair with your back straight against the backrest and both feet flat on the floor. Slowly lift one leg until your knee is almost straight and hold that position for 2 minutes. Feel your thigh muscles engage, as if you were holding an invisible ball under your knee. Don't overstrain, just use 30 to 50% of your effort, enough to feel the muscle working but without shaking. Between each round, rest for 2 to 3 minutes to let blood flow return to normal, then move on to the next set. When you practice this exercise regularly, your thighs become more flexible and your vessels activate more effectively. I once told Mary, the teacher I mentioned earlier, that by simply holding her legs still, she was training her heart to work lighter yet more efficiently.
She laughed and said, "I never thought I could train my heart just by sitting still." Don't you think that's worth trying? Sometimes simplicity truly is the key to effectiveness. And now let's move on to the third exercise, wall sit, also known as the wall squat. This is what I like to call the king of isometric exercises. No equipment, no gym, just a wall in your home. Stand with your back against the wall, feet shoulder width apart, then slowly slide down until it feels like you're sitting on an invisible chair. Your thighs should be parallel to the floor, your knees directly above your ankles, not extending past your toes. Now hold that position for 2 minutes. I know, those first 2 minutes may feel longer than you expect. Your thighs will start to tremble, your heart will beat faster, and you'll ask yourself, can I hold on for another 10 seconds? But that very moment is when your body begins to change. When you push past that threshold, your blood vessels learn to regulate pressure, and your heart learns to pump blood more efficiently without speeding up. And when you stand back up after those 2 minutes, you'll feel as though you've just won a small battle with your own body. I usually recommend that my patients do 4 sets of wall sits, each lasting 2 minutes, with 2 minutes of rest between sets. If you're just starting out, 2 sets are enough. After a week, you'll notice something remarkable. You'll stand up faster, feel steadier when you walk, and when you check your blood pressure, the numbers begin to drop. Some of my patients even report sleeping better and feeling less dizzy upon waking. You might be wondering, can such a simple wall exercise really do all that? And the answer is yes, if you do it correctly and consistently. The best part is that all 3 exercises, hand grip, leg extension, and wall sit, can be done right at home anytime you have a few spare minutes. Each session takes only about 10 to 15 minutes, and within just 4 to 8 weeks, most people see a noticeable drop in blood pressure, feel stronger, and experience a calmer state of mind. You can alternate between them or choose your favorite one. What matters isn't which exercise you do, it's that you stick with it, allowing your body to learn how to balance blood pressure naturally. And now that you know the 3 most effective exercises to lower blood pressure, you might be wondering, where should I start? And how can I get the fastest results? The answer lies in the next part, where I'll show you how to combine these 3 exercises into a complete 4-week program, along with small but crucial safety tips to help you stay consistent and achieve the best outcome. So don't go anywhere, because you're about to learn how to turn just 10 minutes a day into a natural therapy that helps you stabilize your blood pressure and live healthier for the long term. Are you ready to begin your 4-week journey with me?
Now that you've learned how to perform the 3 most effective isometric exercises for lowering blood pressure, it's time to turn that knowledge into lasting results. What you need is a 4-week roadmap, not a complicated fitness plan, but a sequence of small, structured habits that allow your body to adapt and self-regulate naturally. In week 1, simply choose one single exercise, hand grip, leg extension, or wall sit, whichever feels easiest for you. Do it 3 times a week, each session lasting about 10 minutes. The goal during the first week isn't results, it's to familiarize yourself with the rhythm of contract, hold, release, and reconnect with your body. Did you know that within just 7 days of this simple routine, your body already begins to activate its natural blood pressure regulation mechanisms? In week 2, increase your frequency to 4 sessions per week, alternating between exercises to keep your body engaged. For example, practice hand grips on the first 2 days, then wall sits on the next 2. Keep each set at 2 minutes, resting 2 minutes between sets. By this point, many people start noticing improvements. They sleep deeper, feel calmer, and see a small drop in their blood pressure readings. That's a positive sign. It means your blood vessels are starting to regain flexibility. Week 3 is when you'll feel the biggest transformation. You can combine all 3 exercises in a single session. Begin with hand grips, move to leg extensions, and finish with wall sits. At this stage, your body has already adapted to the cycle of contraction and relaxation, and your blood pressure begins to stabilize noticeably. I once told a patient, "Your body is like an orchestra. When your muscles, blood vessels, and heart learn to perform in sync, your blood pressure becomes harmonious." Can you sense that harmony within your own body? Week 4 is the consolidation phase. Continue all 3 exercises 5 times a week, but keep each session to just 12 minutes. This stage isn't only about training your body, it's about training your consistency. After 4 weeks, most of my patients report an average drop of 10 to 12 mmHg in blood pressure. But more importantly, they feel a sense of control. They're managing their bodies instead of being managed by their condition.
What I want you to remember is this. There's no magic here. It's simply the science of persistence. Every time you hold a position for 2 minutes, you're sending a powerful message to your cardiovascular system. I'm helping you work more easily. And when you do that day after day, your body responds with stability, strength, and calm. Can you imagine waking up each morning, checking your blood pressure, and seeing steady numbers, a smooth heartbeat, and no more worries about sudden headaches or dizziness? One more important thing. If you're currently taking blood pressure medication, keep following your doctor's instructions and treat these exercises as a natural complement that helps your medication work even better. In the next video, I'll show you the best time of day to take your blood pressure medicine, because timing alone can make a major difference in how effective your treatment is. Are you curious to know when that moment is? Before we wrap up, I want you to remember this. Health isn't a race, it's a journey. Every day, you have the choice to live more actively, more healthily, and more peacefully. Small actions like squeezing your hand, extending your leg, or sitting against a wall may sound simple, but they can protect you from strokes, hospital visits, and unnecessary suffering. And if something so small can safeguard your heart, why not start today?